Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. As a reminder, please mute yourself, but always show your video picture. Please sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you, and then use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk. So please show your beautiful faces in the video during the group picture taking. Another reminder, please take the online learning cum evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate. I have placed the link in the chat box. The certificate will look like this. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to a voucher for a free ROJoson telemedical consultation. We are now on our 99th OLETE pep talk. So you'll have a chance to get at least 2 vouchers for ROJoson telemedical consultation. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Okay, show your picture, show your faces. 1. Okay. Show your faces. 3 more. Okay. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course in October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Cancer Survivorship and National Cancer Survivors Day. This is in consonance with the Department of Health Awareness Calendar. So the first Sunday of June is considered to be the National Cancer Survivors Day. The empowerment objective is for the lay people to have an essential understanding of cancer survivorship in their health management. The contents of this particular pep talk will be the following: National Cancer Survivors Day in the Philippines and abroad. I will give a short background of this background story and my advocacy on this topic, philosophy and concept of National Cancer Survivors Day. What is cancer survivor? What is cancer survivorship? Phases of cancer journey, common experiences among cancer survivors, need for continuous cancer survivorship care, and then how to contribute to the cause and advocacy of cancer survivorship. As a backgrounder, I became aware of the presence of National Cancer Survivors Day in the Philippines only this year, 2023, when I was looking at the DOH health calendar to guide me in preparing for my pep talk during this year. I was happy to see the inclusion of National Cancer Survivors Day in the DOH health calendar. I tried to trace when DOH started having this in its calendar. I just found records in 2022, last year. So thus it seems that it's just started in 2022. Since 2014, every April 9 in the Philippines, on my own, I've been commemorating April 9 as the Araw ng Kagitingan, Day of Valor, as well as Cancer Survivors Day. This is to commemorate the bravery of cancer survivors, as well as those of the soldiers who fought in Bataan for the independence of the Philippines. Note that the DOH started celebrating National Cancer Survivors Day only in 2022 last year, versus I started it unofficially in 2014. So I'm way ahead. As an evidence, I have this picture in my blogs commemorating April 9 as the Araw of Kagitingan, Day of Valor, as well as Cancer Survivors Day. In April 9, 2014, I was proposing that April 9 should also be considered as a National Cancer Survivors Day in the Philippines. I was thinking April 9 is Araw ng Kagitingan or Day of Valor, commemorating the bravery of the soldiers. For sure, there is bravery in my cancer survivors as well in the other cancer survivors. I was asking myself, why not use April 9 to commemorate the bravery of cancer survivors as well? That is, if there is no official date for such purpose in the Philippines. I searched the internet for information that would answer my queries and that would bolster my idea. There has been no Cancer Survivors Day or a day that commemorates the cancer survivors in the DOH calendar, in the Department of Health of the Philippines calendar, until lately, 2023 and 2022. So I'm happy that I learned when I learned about this in the DOH calendar. But there is a National Cancer Survivors Day in the United States being celebrated every first Sunday of June. It started in 1988. It was established and being maintained by the National Cancer Survivors Foundation, Inc., a nonprofit organization. Though it is mainly celebrated in the United States, the National Cancer Survivors Days Foundation is attempting to grow its popularity in other countries, and I think it has succeeded. On my own, I have 3 activities or projects on cancer survivors and cancer survivorship since 1988. Every first Sunday of December, through the ROJoson Cancer Crusaders Club annual Christmas get-togethers. This is one of the first activity that I had on cancer survivors and cancer survivorship. The next is my Cancer Survivors Registry, in which I list down all those whom I considered as cancer survivors, those who have who were in remission for more than 10 years. Okay. I track them down, I update this registry, and then I publish them online. I've been doing this since 2011. And then, as I said, every April 9 since 2014, I have been commemorating Cancer Survivors Day through online media at the very least. National Cancer Survivors Day abroad, and being done at the present time, is an annual treasured celebration of life that is held in a lot of countries. So as I said, in the Department of Health in the Philippines, it started in 2022. Okay. On my part, it started in 2014. It is a celebration for those who have survived, an inspiration for those recently diagnosed, a gathering of support for families, and an outreach to the community. Participants unite in a symbolic event to show the world that life after a cancer diagnosis can be meaningful, productive, and even inspiring. Cancer survivors face ongoing, often long-lasting hardships because of their disease. These include long-term physical and emotional side effects, increased risk for a second primary cancers and other health problems, and potentially devastating financial setbacks or financial difficulties. On National Cancer Survivors Day, we want to raise the awareness of these challenges on cancer survivorship. So the National Cancer Survivors Day is a celebration, but it's more than that. It is also a call to action for further research, more resources, increased public awareness to improve the lives of cancer survivors. So the National Cancer Survivors Days in the Philippines, since it started in 2022, should also have the same philosophy and concept as those abroad. It should also be an celebration of those cancer patients who have survived, an inspiration for those who are recently diagnosed with cancer, a gathering of support for families, and an outreach to the communities. It should increase public awareness to improve the lives of cancer survivors through a well-defined cancer survivorship program. Now, what is a cancer survivor? There are so many definitions. One definition is this: any person diagnosed with cancer from the time of initial diagnosis until his or her death. Another definition: patients who have completed their cancer treatment and now living through and beyond their cancers. Another definition: surviving, thriving, navigating their life experiences and challenges resulting from their cancer diagnosis. So this one, surviving, thriving, navigating, is more on the psychosocial aspect of the life of a cancer survivor. Another definition: this is the stage where chances of recurrence are low based on track records of specific cancers. In general, they use 10 years as the cutoff for cancer survivor. So this is more on the physical aspect of cancer survivorship. In my registry, I use this one, 10 years. Okay. But for others, they can use the psychosocial aspect of the psychosocial perspective of the cancer survivor. The phrase cancer survivor can mean different things to different people, but the starting point is always a cancer diagnosis. Afterwards, it includes people who have no signs of cancer after finishing treatment. That's one. Another one, people receiving extended treatment over a longer period of time to control the cancer or reduce the risk of its return. Another group will be people with advanced cancer. And then the last group will be people with recurrence. Not everyone who has or had cancer uses the word survivor or cancer survivor. For some people, they don't like it. They feel that the term does not feel right. They may feel more comfortable just defining themselves as person who has had cancer, person living with cancer, etc., etc. So what is cancer survivorship? Cancer survivorship for me, in layman's terms, is the same as cancer journey, but it usually refers to people or patients navigating their life experiences and challenges resulting from their cancer diagnosis. It focuses on health and well-being of a person with cancer from the time of diagnosis until the end of life. This includes the physical, mental, emotional, social, and financial effects of cancer that begin at diagnosis and continue through treatment and beyond. Dr. Mulan identified 4 seasons of survival: acute survivorship, transitional survivorship, extended survivorship, and permanent survivorship. I will go through this one by one. Acute survivorship, this include the time at the time of the diagnosis, which include a lot of shock on the part of the patient and treatment. Most of you who have cancer have usually went through this one, acute survivorship. Then transitional survivorship, when treatment has ended, but survivors still feel anxious, depressed, isolated as they engage in watchful waiting to see if cancer will return. Again, this is quite common in those who have survived the acute survivorship. The third season will be the extended survivorship. So this comes in 3 forms: cancer-free, treatment with free remission, and then they have maintained remission, meaning staying cancer-free due to ongoing therapy, and then living with cancer as a chronic advanced disease that requires continued treatment. And the last one is permanent survivorship. Again, there are 4 subgroups here. So this includes survivors who are cancer-free and asymptomatic. This is the best part. Those who are cancer-free but with long-term or late problems such as fatigue or depression, who have developed second cancer, but which is unrelated to the earlier treatment of the cancer, and then those who have secondary cancer related to earlier treatment of their cancers. For me, I personally would like to classify in a simple manner the so-called phases of cancer journey: the phase of diagnosis, the phase of treatment, which include during, right, or soon after the treatment, and then phase after treatment, meaning in remission, then the phase when there is recurrence or cancer of the cancer, and then last would be the phase during the end of life. So all of these phases will include the psychosocial and physical aspect of the experience of the cancer patients. What are the common experiences among cancer survivors? The bottom line is that cancer survivors face ongoing and often long-lasting hardships because of their cancer diagnosis. So this include long-term physical and emotional side effects, increased risk of a second primary cancers and other health problems, and potentially devastating financial setbacks of difficulties. So as I said, starting when you're in the cancer journey, you usually experience all of these ones: okay? Fear of death, recurrences, anxiety over physical image, anxiety over physical and social functioning, and of course, the last one, which should not be belittled, will be the anxiety over expenses. Okay. Because of these experiences, there's a need for a continuous cancer survivorship care. So what is the cancer survivorship care? It is essentially assisting persons with cancers on how to live a life with cancer, how to live and continue to live a functional and meaningful earthly life after a cancer diagnosis. Cancer survivorship consists of 3 parts. One is the medical care during the cancer treatment, starting in the acute phase, recovery phase, rehabilitative phase, in the recurrence phase, and near end of life phase. And then the second part of the component of the cancer survivorship care will be the patient taking care of herself or himself. So there must be a patient-empowered self-care during the cancer journey. And lastly, placing importance on the supportive care given by the relatives and friends to patients with cancer throughout their journey. So cancer survivorship care is essentially a multi-partnership care. So it can consist of just these two, medical care and the patient-empowered self-care, or the best will be to have these three, medical care, patient-empowered care, and care from the caregivers. So here are my tips on the cancer survivor medical care. When I say medical care, it's on the aspect of the care by the health professional. So my first tip will be try to have one holistic coordinator or oncologist who is not biased with subspecialty, because we know that there are a lot of there are different kinds of oncologists. You have the medical, surgical, and radiation oncologists and other oncologists. Okay. So who is not biased with his subspecialty, and who is well-rounded, and who is compassionate, and who can take care of cancer patients all the way up to the near end or end of life. So all the way, not one oncologist passing the bug to the other cancer oncologist. Okay. Number two, to keep all the medical records important in the medical management, because as we said, it's a cancer journey. There are a lot of things that you have to manage in terms of records. You have to, when you consult the physicians, you must have all the records in place. Okay. And then lastly, my tip will be to be empowered as a patient, as a cancer patient. So these are the three basic tips in the medical care as part of the cancer survivorship care. My advice on living with cancer would be the following: acceptance of the cancer diagnosis. That should be the first thing that everybody will have to do, all cancer patients will have to do. Number two, intentional living plan in the light of the cancer diagnosis. Number three, trust in a competent and compassionate physician. As I said, you look for a holistic surgical oncologist, or not surgical oncologist, any oncologist, but who is holistic in his care. Then number four, spiritual trust. Number five, support from loved ones and significant others. This is also very important. And then, of course, cancer journey sharing. How to contribute to the cause and advocacy of cancer survivorship. Okay. From the perspective of a layperson, as well as from a health professional. As a layperson, I would suggest that be an advocate. Educate your community of people, meaning your relatives and friends, colleagues, on cancer survivorship. Okay. But before you do that, you must be able to understand, the cancer survivorship processes which I explained earlier. And then provide compassionate assistance to cancer patients that you know, and also include those you don't know, your neighbors, okay, in whatever you can, like educational support, meaning helping the patients to be empowered on cancer issues, and then giving them moral support and also financial support. So these are examples of support that you can give as a layperson contributing to the advocacy of cancer survivorship. But if you have cancer as a layperson, you try to connect with other cancer patients like you to provide support to them, as well as mutual support. Share your survivorship story, because by sharing your story, be it a personal mantra or other words of encouragement, you can help other people feel they're not alone as they navigate their cancer diagnosis. As a health professional, In contributing to the cause or advocacy of the cancer survivorship, the health professional should also be an advocate, and he should be able to educate the public. But just like for the lay people, before he can do this, all these things, he must understand the cancer survivorship processes. And also, the health professional should be able to provide compassionate assistance to cancer patients in whatever way he can, like educational support, moral support, and even financial support if indicated. As a health professional example, like me, I have formed or encouraged cancer support groups such as the Cancer Crusaders Club, and I have also encouraged, or I have been encouraging patients to share their cancer journey. On a daily basis, I have provided compassionate humanitarian services to cancer patients who consult me. As I mentioned earlier, April 9, okay, starting 2014, I've been advocating the National Cancer Survivor Day, but starting 2023, it will now be in June, the first Sunday of June. Okay. So through the ROJoson Cancer Crusaders Club annual Christmas get-together, okay, so we have been holding this since the first Sunday of December, starting 1988, and then Cancer Survivors Registry, okay, which I've been doing this since 2011. So this is a picture of the first annual Christmas get-together of the Cancer Crusaders Club in December 4, 1988. The primary objective of these Cancer Crusaders Club meetings is to provide psychosocial support and therapy among cancer patients. The annual year-end meetings of the Cancer Crusaders Club are traditionally being held on the first Sundays of December. So up to now, we're still maintaining this. Okay, the last one that we had was on December 3, 2023. This is 2022, last year. Okay. Yeah, 2022, last year. Okay. And then we also had this cancer journey sharing. Okay. So showing the pictures of people who have shared their cancer journey in 1988 to 2019. In 2020, during the pandemic, so we still continue on with the cancer journey sharing. In 2021, so these were the people who shared. And then 2022, last year, showing the people, the cancer survivors who shared. And then regarding the Cancer Survivor Registry, I have published this in the Google site, in the WordPress.com, and in Facebook. I have publicized this to give inspiration to other cancer patients. So there are a lot of cancer patients who look forward to 10 years and having a picture with me, and who wants to be recorded as part of the cancer registry. As of May 2, 2023, I have a registry of 168 cancer survivors who have been in remission for 10 years or more under my care. As I said earlier, I use 10 years as the cutoff to be as a criteria or as a parameter to be included under the Cancer Survivor Registry. So some pictures on the cancer survivors. Okay. So summary and takeaway, I have presented all these topics: National Cancer Survivors Day in the Philippines and abroad, ROJoson background story and advocacy, philosophy and concept, cancer survivor, what is cancer survivorship, what are the phases of cancer journey, common experiences among cancer survivors, the need for continuous cancer survivorship care, and how to contribute to the cause and advocacy of cancer survivorship. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on cancer survivorship. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment. First K is kaalaman, second K is kakayanan, third K is karapatan, and fourth K is kapangyarihan. Use the 4Ks to gain greater control over decisions and or make better decisions in cancer survivorship issue in one's health management. So with this, I end my pep talk today. I hope I have empowered you to have a better or essential understanding of cancer survivorship in your health management. Before we go to the question and answer portion, reminder, take the OLETE for Mastery of Learning. The link has been placed in the chat box. 50 OLETE certificates will entitle one to a voucher for a free ROJoson telemedical consultation. Please type in your feedback in the chat box during the open forum and before we adjourn. And then let's now have a group picture taking before we start the question and answer interactions. Okay, ready? Everybody shows their faces, beautiful faces. Mel, are you there? Chris? Bibi?
I'm here na po, kasama si Inay.
Yeah, your picture. You don't like to show your picture? Okay. Oh, sige. You're there already. Okay. 1, 2, 3. Okay. The floor is now open for questions, comments, sharing of experiences. No, if you have. So all of you are considered cancer survivor? No, not everybody has cancer here. Okay. Okay. So can I have a show of hands who consider themselves as cancer survivors? Zenny, Edna, who else? Susan. Okay, ladies. Mary Ann, who else? Conchita Surya, Jessel Macboo, the mother. Okay. And then Mel Cabrera. Okay. Melingo, Chris Nicesia. Okay. Cherry Codillo, I suppose you consider yourself as cancer survivor. Okay. Erlinda Naisa. Okay. Ellen Enriquez Veloso. Okay. Okay. Rolina Oreta. Okay. Phoebe Hipos. Okay. Thank you. So we have a lot of cancer survivorship here. So would you like to share your experience?
Doc, this
Yeah,
is Susan.
Susan? Yeah.
Okay. I wish I had attended this kind of program before because I was a cancer survivor in 1997, although earlier in the 80s, I had a mass in the endometrium, but it was benign, so it was not cancer. 1997, it was thyroid cancer. Why did I say I wish I had attended this one? Because after the operation, after the treatment, wala na. Parang you're on your own. I don't know. That's how I felt, no? And of course, I had people who supported me. I had a niece who was with me, and fortunately, I was working. So I underwent radiation. No, I underwent radiation. I think dyan sa Manila doctors pa nga.
Radioactive ID. Radioactive ID therapy.
Yes. It was a little difficult because you have to be in the room by yourself. Nobody can see you for 1 week. they can talk to you on the phone, but for somebody like me who was a social person who would rather see people, and then you know that you are sick like that, and nobody can go inside your room. Even your food is delivered at the door. They will just knock. The nurse will call up and then send. So, what did I do? Of course, first, since I knew that I would be treated, hindi pala. Can I go back a little? When I
Sure.
learned about it after the operation, sorry syempre I was stunned. Sabi ko, ano to? Is it true? O, it's the usual reaction. But anyway, there was at the same time acceptance or acceptance na kasi you do not accept what happens, no? So anyway, underwent that, and then ano pala, no, tinatapon, yung palang mga damit na ginamit ko sa radiation, pinapatabi, and then parang sinasunog, tinatapon, I don't know.
Sinusunog?
I went home. Oo, parang ganon. I went home, ang sabi lang sa akin, just yung usual na kumain ng sustansyang pagkain, and that's it, no? My mother didn't even know, it was already line of age, she didn't even know that I underwent that. And I didn't bother to tell her anymore kasi baka naman lalo pang ma-high blood yung tao. So, some of my friends knew, okay? So, ayun, and I had to see an endocrinologist once a quarter, every quarter. Kasi monitor yata yung, ano ba yun? Yung mga TS, something like
Thyroid
that.
function test.
Yes, yung mga ganon, no? Anyway, I went on leave for 1 month, no? I was thinking that there could have been a group like the one you organized, kasi it would have been easier, psychological, psychosocial, to relate, because I work with DSWD, but iba yung ikaw yung affected personally. It's always nice if there are people who underwent similar process, similar experience, and you're able to share. Wala akong ganon, no? Wala akong ganon. So, fortunately, when I went back to the office, mga after 2 months, back to work, people were very friendly, basta yung usual lang na wala nga ayoko masyadong maraming taong nakakaalam. Basta, pero lang kung may mga, parang manghina ako or something. I was able to survive until hanggang kailan. Okay na ako. Parang nobody even knew among us. I was my usual ebullient self. I was until, well, you know already, another thing happened na naman. So, part of the journey, pero I said I would really attend this session because I'm really interested how you were able to not organize it, how you're going to tell us in a very educational, informative way who is a cancer survivor, what are the different stages. Yun ang mga hinahanap ko nga sana noon eh. Walang ganon, pero I'm glad that I attended this one. Thank you, Doc.
Thank you for sharing your experience. So you started your cancer survivorship or cancer journey in 1997 after your total thyroidectomy, for papillary thyroid cancer. So actually, the most ideal scenario is that it's either the surgeon who operated on you would also serve as the coordinator for your cancer survivorship care, or if not, the endocrinologist should take care of you. Okay. And ideally, they should take care of you for a long time, because there's a need for continual monitoring, usually for the rest of your life. So there must, as I said earlier, there must be a health professional. My tip is that you look for a oncologist. Okay, once you have cancer, you talk about you're referring to a doctor who is an oncologist, who is a cancer specialist, no? It doesn't have to be a surgeon, okay? It can be anybody who is well-versed in cancer treatment, no? Who can take care of you, who can coordinate everything, no? As I said, that specialist should not be biased to his specialty, no? Kasi a lot of doctors are biased to their specialty, who can provide comprehensive and then objective treatment, management of your case, no? Okay. And then, so that should be the starting point, no? Okay. And then after that, you must have support of your relatives, no?
Oh, yeah.
And then on your own, if you don't have if you lack the first one, the physician, you have to be empowered. You try to be on your own, try to empower yourself to take care of yourself. Then, if you are the relatives, mas maganda. Mas because relatives are very important support also, no? Okay.
Yeah.
So it's not yet too late, Susan. So you can help others, no? Okay. So by sharing, you're actually helping. You're trying to help others also, no? In the audience right now. I suppose.
Actually, Doc, sorry. Actually, my sister told me to have a devotion to Saint Peregrine ba yun? Basta dalawang saint who are saints na who help cancer patients. That's what I did before. Kaya lang naging busy na, you know, my work and everything. I even forgot that I had cancer. To tell you. Because, normalized na everything and syempre, I was alone. I'm alone, no? So, natanggap ko na-treat na, remission na after 1997 no? So 2007, wala, okay na. Kaya lang, as I said, it would have been better if there was a group that the organized group, just like your Cancer Crusaders club, which I would have joined and whose members and experiences I would have heard, no? Well, it's not, as you said, it's not really too late.
Yeah, not
So,
too late.
thank you.
Okay, so you're helping others now. Now you're actually trying to contribute to the cancer survivorship of the community now. There are about 20, 25 people in the audience right now listening to you. No? So by your sharing, you're also inspiring them already. No? Okay.
Thank you.
Thank you for sharing. Okay.
Thank you.
Any more comments? Questions? Sharing? How about Conchita Surya? I saw Conchita Surya. Conchita, would you like to share? So 1988, si Conchita, she attended the first Cancer Crusaders Club right after her surgery. So 1988, 20, ilang years na yon, no? So would you like to share your cancer survivorship, cancer journey, Conchita? Conchita is from Quezon. I hope the reception will be good. Unmute yourself. Unmute. Conchita, unmute mo yung sarili mo. Unmute. Wala. We'll go back to you later on. Okay. Paki-check na lang yung yung system mo. Any other comments?
Doc?
Yeah.
Hi, Doc.
Edna. Edna, nice to see you. Okay.
Yeah. I didn't
you like
want Doc, I'm
Yeah.
on Monday. I had my third chemo and my second Keytruda last May 31. it's now June 3, I'm on my third day from the treatment. And so far, I'm okay. I have well, anyway, for everyone's information, I had breast cancer, I think stage 3 in 1991. And I survived for 31 years. And only last December, I discovered that I had stage 4 cancer of the lungs. So, of course, that was devastating. I was so scared. I talked to Dr. ROJoson, and he suggested I come to Manila for PET scan. And I consulted an oncologist in Iligan, where I'm from. And I was referred to a very able doctor here in Manila. He's a medical oncologist, not a surgeon. And I'm under his care. Now, I'm a survivor, but I'm still also now what would you call me, doc? Cancer patient again.
Yeah. If you are, just call yourself cancer survivor, but if you base it on the classification of Mulan, no, the Dr. Mulan that I mentioned, you'll be under extended or extended survivorship, or even the permanent survivorship. No?
Yes,
Okay.
friend, it's not related. My second cancer is not related to the first one.
Yeah, that's why I said in cancer survivorship care we have to monitor, and also we also note that the problems that cancer patients face will be another cancer in the future, di ba? Not really related to the first one. It could be another cancer, no? So these are the challenges of cancer patients. Okay.
Yes, the reason that I wanted to talk is just to give others, I don't know, hope, inspiration. I was really so scared when I found out. Can you imagine the shock of your life? You're living a normal life, except that you have cough, and all of a sudden you find out that you have stage 4 cancer of the lungs, and that's really scary. So, of course, Dr. Olson told me, surrender na lang to God. Everything is God's will. I said, no, I have to ask God to cure me, to heal me. So anyway, I tried. Now, so far, my treatment seems to be okay. I don't know if I'll survive, but I think I will. I'm pretty sure. How long, I don't know. It's really all up to God. So if it were for me, maybe I shouldn't go through this, because as Dr. Olson said, the physical and the emotional, it's okay. My family is there to support me, and the spiritual. But the financial obligations is quite heavy, huh? But, well, money you can find, but life hard, you know? So of course we try. So there are always ways we can find it, but we're also the others if they cannot find it, no? But these are the things that I'm sharing that I don't know. I think just have to leave it to God and pray and trust. Don't surrender, just keep on praying. And just keep having a good attitude, happy. And it helps that your family is, especially when your family is behind you, supporting you. You have your doctors. And that's it. I want to tell everyone that it's not the end of life. So if anything happens to you after your first cancer, or you're still suffering, look at me. I think I'm fine. Sayang lang, I didn't fix myself. I was going to make myself pretty, but I was so sleepy earlier. Because right now, Doc, because of the I'm undergoing chemotherapy and immunotherapy at the same time. So because of that, the effect on me is I developed hyperthyroidism, which means I'm super active, no? So it's only that finally my medicine is taking effect, and I've slowed down, because I was so super active that I was always washing the dishes. I was always doing something, not stopping to Then, of course, I have to stop, no? Heart attack ako or something like that.
Mhm.
So now I'm fine. I slowed down. I was able to take a nap. So it's not the end. For anyone who's undergoing anything they're suffering, don't be afraid. If you feel anything, go right away. Have a checkup. Don't go through denial anymore. Don't hide it. Just face it. Okay, that's all I have to share. I don't know if there's anything else that I should share. It's just I just want to thank Dr. Hoson for giving me the first chance. And Beth too, because she's always been there.
Yeah. Okay. Thank you. Thank you, Edna.
Thank you,
I'm
Doc.
I'm glad that you attended our forum today and then you were able to share. Okay. So I'm sure the other people listening to you are being inspired also by your story. Okay.
Yeah.
So
Thank-
number one, let me summarize in relation to my lecture is that Edna has been with me for the past 20, how many years?
31.
31 years.
Yes, Doc.
31 years. Okay, we've been together. We've been monitoring. So as I said, you must have a oncologist who will take care of you, who will look over you. No, of course, sometimes the cancer may not be his line, just like me, because he developed a lung cancer, but I was able to advise her properly what to do. No, okay. So, and then this is also an example that you can the so-called difficulty, the challenges that all cancer patients will have, but it's not so common that you will have another cancer coming up. No, okay. So not related to your first one. Edna now has a lung cancer. She mentioned it. No, okay. So, but I think the most important thing is just keep on praying and hoping, no, that everything will be fine, and then trust in the Lord, no. And then I guess we always end up with a statement that your will be done. No? Okay. So we don't have any control on this now. Okay. But just the same, still pray and hope and do something about it, and then end up with a statement that your will be done.
Yes, yes.
Okay. Thank you, Edna.
Thank you, Doc.
You're welcome. Anybody else wants to share? Conchita, are you ready? Hindi makapasok si Conchita.
Okay.
Who else would like to share? Yung mga bago naman. Chris, you want to share? You say share?
Hello, Doc. Hello, everyone. Good afternoon.
Okay.
Actually, nagdadalawang isip ako mag-share today kasi just recently lang din nang ako nagkaroon ng na-diagnose ng breast cancer, and sobrang thankful ako at saka feeling ko sobrang blessed ako kasi during my medication, nakilala ko si Doc Hoson. Napakalaking tulong yung naibigay na tong mga webinars na binibigay niya, ginagawa niya sa atin every Saturday, no? So, 2020, na-diagnose ako, then nag-undergone ako ng medication. Pero 3 years pa lang, no, before nung huli po akong nung na-treat ako. So praying and hoping ako na sana hindi siya bumalik at maging cancer survivor talaga ako para mas lalo ko din maka-inspire din ako ng mga um, cancer patients na tulad ko. So ang ginawa ko, meron akong ka-sister company, nalaman ko nagkaroon din siya ng breast cancer. So yun, ang ginawa ko, in-assist ko siya, yung mga natutunan ko dito, shinare ko sa kanya. And then lahat ng mga clarifications niya, lahat ng yung mga fears niya during medication, yung mga nararamdaman niya, tinulungan ko siya, in-assist ko siya. Kasi same na same kami ng stage, same kami ng cancer, yung breast cancer type. Then parehas na parehas kami. So now, on the way to recovery na rin siya, natapos na yung chemotherapy niya, nakapag-operation na siya and radiation. Nag-ano na lang kami ng targeted chemotherapy, yun na lang yung tinatapos niya. So, ang saya-saya ko na ano doc, na guide ko siya kasi sobrang pag ikaw kasi yung nandoon sa situation, sobrang hindi mo alam kung saan ka kakapit kundi kay God na lang talaga at saka yung sa family mo, yun na lang talaga yung iisipin mo, yun na lang talaga yung kakapitan mo pag ikaw yung nasa ganong situation. So, happy ako at nakita ko siya ngayon na na unti-unti na nakaka-recover, pati yung face niya, pati yung and hopefully kapag papasok siya by August, magmi-meet kami, makikita. Sabi ko nga happy na kami at kino-consider namin na in a way, we survive talaga. Survive and praying na sana tuloy-tuloy na yung namin, yung paggaling namin.
Thank you.
Thank you. And thankful talaga ako sa inyo, Doc. Ang dami-dami niyo pong naturo at na mga lessons ibigay po sa amin. Thank you so much, Doc Hoson. Kasi si Doc Hoson, anytime yan Anytime talaga mag-leave ka lang ng message sa kanya. Hindi siya tulad ng ibang doctors na kailangan po pang i-meet, kailangan mo pang magpa-schedule. Hindi, siya, anytime talaga siya. Thank you so much, Doc. Sobrang appreciated ka po namin.
Okay, you're welcome, Chris. But thank you also for sharing. And then in relation to our topic, thank you for being an advocate of cancer survivorship, no? So you try to help another person, no? So pagpapalaan ka ng Diyos, now you're helping other people. So thank you for sharing, no? Anybody else who want to share? We still have 10 minutes or 5 minutes to go. Anybody? Raise your hands if you want to share. Lana?
To say something, Doc?
Sure, Susan.
Okay, oo. Of course, you know that I have cancer again. I might, and you're scheduling an operation for me, no? That was the time I felt devastated. Kasi sabi ko kay God, di ba dapat nakakota na ako? Anyway, it was a joke. Pero now, bakit noon? Because I was working, I was stable and everything. Parang okay lang. And then friends, Bakit ngayon? Parang, may time na anxious ka. Kasi unang-una, bukod sa I'm at the last quarter of my life, no? I survived on pension. Medyo sabi ko, paano to? Sabi ko pag ganyan. Ang magiging problema pera. Kasi, okay, I know after that there's gonna be treatment. Sana nga ako magmilagro Sana biglang sabihin nito, ay mali pala, hindi pala. Naku. Papasalamat ako. Pero, it's possible, of course, you'll be anxious again. And it's good that I have some supportive friends who come around. And, pero, ang talagang problem talaga is, I know, money will be involved. Ayun yung medyo, yun ang siguro nagiging reason. Pero, I tell you what, I've started something. I don't know if the other people here, when I learned about this second, sana nga hindi nga, baka nagkamali lang sana. I started a journal, a gratitude journal. Ibig sabihin, every day, I write about the things I'm thankful for and things that God gives me through people. And sinusulat ko lang and I feel better. I feel better because yung bang hindi ka na yung hindi na negative ang feeling mo, kundi be grateful that you've been alive for how many years. Be grateful with the people who were in your life before. grateful for what's happening now and everything that that comes to your life now. So I write them in a gratitude journal. Ang dami kong naisusulat. Ang dami. And siguro yun yung reason why I feel better, I feel okay, because the moment we become grateful to God and to people, nalilesen yung, ano ba yun? Nalilesen yung anxiety, nalilesen yung sadness, nalilesen yung mga negative things. Yun lang, that's what I'm doing now.
Thank you for sharing also on how to, this is actually a tip not only to survive cancer as a problem, but for all other challenges in life, di ba? Parang ano yan eh, life is not full of, is not parang malaging tranquil, no? Serene. There are a lot of challenges, difficulties going on in our lives, no? Okay. So we know that we have crosses to carry, no? So we must know how to accept them and then how to manage it, no? So one is by being thankful also to God that it's part of our journey and how to cope with it. I hope you can share some of your gratitude journal.
Doc, it's a gratitude journal.
Very good.
I just started it 2 months ago. Sabi ko, bakit na kaya, why don't I just start thanking God about a lot of things? Every day, meron akong naisusulat. Sabi ko, tignan mo nga yan. Sabi ko, no, siguro, it was the Holy Spirit who taught me that na, and I feel happy, I feel at peace. Kasi nakakatuwa, Doc. Once friends know that you are sick or hindi naman, ako naman I don't feel sick right now. Baka ako pag na-opera ako, magkaano ko, no? Pero all of a sudden, some friends come to you and tell you, come where we go out, or like another friend who is a Focolare member, no? She picked me up at home last weekend, and she picked me up here, and we went to her house in Tagaytay and had a wonderful time. It was a place where you can commune with God and nature. Dami ng pinintahan. Nagkaroon pa ng matin pa kami healing mass. So sabi ko, na I was with people, with friends. I had a lot to write about. Sabi ko, God, ang bait mo talaga. Puro, in spite of the impending na sabi ko, basta sabi ko, ang bait mo talaga, Lord, because you bring a lot of good things. Kung minsan lang, nakakalimutan namin, o kaya nakakalimutan ko because of problems, difficulties. Pero once you look at, the moment you look at it, we look at it that way, no? Even the people from the engineering and public works in Makati who dreads the canal in front of me, I took pictures of these people and sabi ko, ilalagay ko nga sila sa for thank you. Ang daming pwedeng pasalamatan. It's about time now we don't only keep it to ourselves, we share it to other people, for other people to know that God gives us a lot of things to others. Ganon. Thank you.
Yeah, that's what I've been trying to do also. You notice in my Facebook, I always thank some
Yes,
people.
I read that.
So be grateful to what we have, but we also be ready to accept yung process. Ang yan ang pinakamahirap din eh. No? Mahirap tanggap. Okay,
Right.
now it reminds me of a song, Count Your Blessings. All of you are familiar with that? Count of Your Blessings. It's a song. Parang gratitude journal mo rin yun, di ba? Count your blessings. Thank you. So later on, probably I'll try to show to play it, no? Okay, but let me listen to more sharing if there are. Meron pa ba mag-share? Sherry, you want to share something? Sherry, Conchita, are you ready to share? Wala na. Wala na? Okay. So kung wala na, I will try to see if I can play it here. Sandali, ha? Count your blessing. Nawala. Wala. Wala. Anyway, count your blessing yon, na? Okay. Okay, just play a part of the song, Count Your Blessing. So any more comments, suggestions? If there are none, it's already 3:10. Last call for any person who wants to share. Nana? Can you still hear me? Are we still on?
Yes.
Okay.
Yes.
Okay. So thank you for the sharing of experience by some of you. Okay, I hope the other who have heard the sharing have learned from it and have been inspired. No? Especially we have some new cancer patients in the group. No? So next week, as part of the continuation of this celebration of cancer survivorship, I was thinking of a common questions being asked of me or being asked for any type of cancer patients. Ang palaging tinatanong sa akin ay, may taning na ba siya? May taning na ba ako? Diba? So I will try to develop this into a lecture. May taning ba ako? May taning na ba? Diba? Yan ang palaging tinatanong ng mga cancer patients. No? So next week we'll have that as a topic. I hope I can finish developing it in due time. No? Okay. So if there are no more questions, we will call it a day. Okay lang? Are you all ready to leave this forum?
Yes.
Okay.
Thank you, Doc.
Thank you, Doc.
Thank you,
Thank you po,
Doc.
Dr.
Thank you,
Ray.
Doc.
Welcome.
Thank you.
Thank
You're
you, Doc.
welcome.
Thank you so much.
You're welcome. Bye-bye.
Bye-bye, Doc.
Thank you,
Thank you.
Doc. Thank
Bye-bye
you.
po.
Thank you.
Thank you,
Thank you,
Doc.
everyone. Thank you for sharing too.
Thank you,
Bye-bye.
everyone, for
Bye-bye po.
sharing.
Bye-bye.
Thank you, Doc.
Bye. Thanks.
Bye-bye. Thank you.
Bye
Thank
po.
you.
Who is the ROJoson PEP Talk? Sino kaya? Sino yung ROJoson PEP Talk? ROJ PEP Talk, sino ito? Abet, sino ito? Para ma-identify ko lang.
I don't know. Nakita ko rin yun eh. But I'm not so sure.
That's not me.
Oh. Baka may
Yeah, just want to know kung sino siya para ma-identify lang natin. We can
Nakita
welcome him. Can you
Nakita ko rin.
unmute yourself, ROJ Pep Talk? Kung pwede lang.
Pero wala siyang camera, wala din siyang audio, just the name.
Okay. I'll see. Baka may hits lang ito sa computer ko. Ewan ko. I'll check. Okay. Thank you. Thank you very much. We'll see each other next week. Bye-bye.
Bye.